So for my project, I am doing it on bipolar disorder. So there are 3 different types of bipolar disorder. Bipolar 1 disorder is defined by manic episodes that can last up to 7 days. Some manic symptoms that include rapid loud speech, flying suddenly from one idea to the next, increased energy with hyperactivity, inflated self-image, excessive spending, hypersexuality, and substance abuse. Some unique symptoms is that they are feeling incredibly high or euphoric, and that they get little to none sleep, and it doesn't affect their energy levels. All these symptoms could be so severe that the person could need immediate hospital care. Some people also get depressive episodes that can typically last up to 2 weeks. Those symptoms include hallucinations, delusions, mood swings, irritability, and loss of energy, and cognitive loss. So bipolar 2 disorder is a pattern of depressive episodes and hypomanic episodes, which is when your mood state or energy level that is elevated above normal. So this disorder does not have a full-blown manic episodes that are typically in bipolar 1 disorder. It usually consists of going suddenly from one idea to the next, having exaggerated self-confidence, rapid and loud speech, increased energy with hyperactivity, and decreased need for sleep. It does have some of the same symptoms as bipolar 1 disorder, but it isn't full-blown like bipolar 1 disorder. So the third one is psychothymic disorder, which is a period of hypomanic symptoms as well as depressive symptoms that last up to 2 years and 1 year in children. The symptoms, however, do not meet the diagnostic requirements for hypomanic episodes and depressive episodes. So how does this compromise everyday function? So many people with this disorder is still highly functioning individuals and can maintain healthy professional and personal lives. But untreated bipolar disorder is more likely to worsen and interfere with your daily life because you have suicidal thoughts and actions that can occur if you have a manic or depressive episode, which makes you act irrationally, and you can do things that can endanger yourself or other well-beings. What is a common cause of bipolar disorder and the risk factors? So some of the common causes of bipolar disorder is having a first-degree relative, such as a parent or sibling, with this disorder. Also having high periods of stress, such as a death of a loved one or a traumatic event. And a popular cause is a drug or alcohol abuse. And there is not a single risk factor because there are multiple risk factors that I listed above that work together to trigger this disorder. So this typical age of onset for this disorder is average age of onset is about 25 years old of age, and it can occur in teens and childhood, but it is more uncommon to hit children and adolescents. So is there a target population that is at higher risk? So women are more often to have a seasonal pattern than men of the mood disturbance than men, and also Asian Americans are 20% more likely to be diagnosed with bipolar 1 disorder than whites. So medications that are commonly used are mood stabilizers, and it's to control your manic or hypomanic episodes. There's also antipsychotics to help with depressive or mania, anti-anxiety medications, antidepressants, and antidepressants with antipsychotics medications that are all commonly used to help this disorder. So to identify and explain if there's any special considerations with this medication. So for mood stabilizer, it requires increased vigilance in monitoring for her treatment, emergent illnesses, and effects on comorbid medical illnesses. So 2 appropriate nursing interventions that I would use. So I would use a behavioral therapy that focuses on behavior that decreases stress, and I would also use cognitive therapy that involves learning to identify and modify the patterns of thinking that accompanies mood shifts. So when teaching patients, it would be appropriate to teach patients how to learn about the illness on their own rather than wait for someone to teach them otherwise, because there's a lot of different types symptoms, and other people could teach you something else that you don't have, and it can get you a lot of anxiety, so it's better to learn on your own. So how to assist an individual with coping and management for this disorder. So to help with coping management, you can teach them about the disorder so they can know what it is before trying to manage it. You can also help them focus on goals they have, write down a list, and get them to focus just on that rather than focus on the disorder. There are multiple support groups that they can manage it. I'm going to be listing some below. You can also find healthy outlets such as hobbies and exercising, and to learn to relax and manage stress such as yoga or meditations, tai chi, and all things like that. So a list of resources that can help with bipolar disorder is Depression and Bipolar Support Alliance, which is a national organization that focuses on supporting individuals who have a depressive and bipolar mood disorder. The organization also offers a support network for parents for children with pediatric mood disorder. The second one is the National Alliance on Mental Illness. It works to support and educate the public about various mental disorders with the goal to improve the quality of life for those who are diagnosed with mental illnesses. So the third one is American Academy for Children Psychiatry, that is a nonprofit organization of physicians that other mental health professions that help children, teens, and families affect the mental health, behavior, or development problems. So American Psychiatric Association is also an organization of psychiatrists who unite to guarantee compassionate care and effective treatment for all people with behavioral and mental disorders, substance abuse, or intelligence disabilities. And there's also a lot more resources, which is a quick look up on Google. You can find many. So how's an individual clinically diagnosed? And identify the criteria. So there's a couple ways to see if you have bipolar disorder. You could have a physical exam and lab test to see if you have any medical problems that could be causing the symptoms that you have. You can also have a psychiatric assessment, which is a psychiatrist who will talk to you about your thoughts, feelings, and behavioral pattern. You can also mood chart. It's where your doctor will get you to keep a daily record of your mood swings and sleeping pattern. So the criteria of bipolar disorder is based on the DSM-5, which is when you have a distinct period of abnormally and persistent elevated expansion or irritability, mood, and abnormally and persistently increased activity or energy lasting up to 4 consecutive days. And these are mostly every day or nearly every day. So what are the negative stereotypes associated with bipolar disorder, and how can it be a barrier to get treatment? So to start off, people think bipolar is a cool trend. Medical professions invented bipolar so they can profit off it. People don't see bipolar. Bipolar is all about mood swings. People with bipolar disorder have mood swings every couple minutes. Saying everyone has mood swings. Mania is fun. Bipolar people are crazy. People with this disorder just need to try harder, think positive, and just snap right out of it. Bipolar people should not have kids. Bipolar people are violent or dangerous. Bipolar is just an excuse for wild or bad behavior, and thinking because you are moody and did a test online that you have bipolar disorder. So these barriers to get treatment, because having negative social support makes people have a fear and anxiety of getting treatment because they don't want to be judged on it. So usually it becomes untreated and it just worsens over time. So thank you. That was my project.